Hey there, I'm Dana Johnson, dental practice management expert, certified Dentrix trainer, and founder of Navoni, revolutionizing the dental industry through innovation and strategic leadership. It wasn't long ago that I lived in your shoes, navigating the daily challenges of managing a dental practice with the hopes and dreams of having a productive schedule, money in the bank, and getting home on time to my sweet daughter. After 25 years working in the dental practice and 17 years as a certified Dentrix trainer, I found my life's work, helping dental teams one-on-one, optimizing their systems and software. If you are looking to create the thriving dental practice you have always dreamed of and empower your high-performing dental team, you are in the right place. Let's get started.
Hey there. All right, welcome back. And so today what I want to do is kind of tack on a little bit more information from a podcast that I had a couple weeks ago where Dr. Mitchell Gardner and Ryan Donahue were talking about protecting your doctor if they ever, heaven forbid that happened, that they were ever in a lawsuit. And probably the number one takeaway for me was that how much the health history plays a part in protecting your doctor's license and protecting your livelihood. I mean, you work in this dental practice, and if something ever happened to the doctor's license, you're out of a job. And so it's really important that we look at the health history workflow in a much more important light. And because I'm in different dental practices every week. Sometimes every day I'm in different dental practices software. And so I see the workflow that you're doing on a regular basis when it comes to the health history. And, I am seeing things that would not hold up in court. They would, your doctor is either going to lose their license, or they're going to go to jail because of the lack of documentation in a lot of dental practices that I go into. And so it's really important. So I really wanted to have a kind of a second conversation about this. This won't be our last conversation about the health history, but I wanted to talk about three main points today. Number one, I want to talk about how to get better patient compliance when it comes to getting the patient to fill out a health history, getting them to release information for you. And so that's number one, patient compliance. Number two, I want to talk about is electronic forms nowadays is a must. It is something that we need to get implemented into your practice, and we'll talk about why. And then the third thing I want to talk about today is eliminating redundancy. So we can't have the health history information in three different places. Okay. So let's dive into each of those three, and then we will just start a better conversation about the health history workflow. So how do we get better patient compliance? And so recently I've been in some practices and they've been implementing some new forms. And what that means is that they have been asking patients to, fill out a new form. And because maybe they've changed some of the words or some of the questions on their form. And the patients are, they basically hand it back to them and say, I just filled this out. Why do I have to keep doing this? Nothing's changed. And so what happens is your team just kind of, complies with the patient and writes no changes in the documentation, which is the worst thing that you can write. If you've been working with me at all, if you've listened to any of my courses, I have a course in the membership called Creating a Health History Workflow Everyone Will Love. And I talk about how no changes is my biggest pet peeve. Like if I'm working with you and I see the word no changes, we're going to change that very quickly. Okay. It's because it's like no changes to what? Then you have to go searching back and find, okay, well, what's the most current health history information? Where was the most recent medication list, or where was the most up-to-date information about the patient's medical conditions or allergies. And so no changes does nothing for you. It does nothing to protect your practice. It does nothing to protect your doctor's license. It's really kind of just a scapegoat. It's kind of just a lazy way of doing the health history. You're just accepting the patient's words of no changes, and then there's really nothing that you can go back to. And so it's really important that we do have a really comprehensive way of gathering patient information. And so, a lot of the practices I've been working with, they're like, well, how do we get our patients to fill out a form? They just scribble on it, or they draw a line through it, and they won't fill it out. And I think what's really important that we do is we have to educate our patients that we are a healthcare facility. And, we're not just dentists. We are not a dental practice. We are a healthcare facility, and our dentists are oral health physicians. I think that's what we should start calling our dentists now, are just oral health physicians, because we are in the healthcare industry. And I think patients get that perception that we're really not in the healthcare industry because our insurance is different. We don't show up we have 2 different cards, medical insurance cards, so there's this perception that we're not in the healthcare industry. Even back in COVID, the dentists were not, essential. And so people think, well, they're not essential. They're not in healthcare. And so they think that they really don't have to fill out a health history form on a regular basis. And so it's really, really up to us to educate the patients that we are a healthcare facility, whether that comes from the front office, because a lot of times the form is coming into the front desk team first. Whether you are handing the patient an iPad or you're sending them a link to their phone, a lot of times the health history form is coming into the front desk first. And so the front desk is having to field a lot of these pushbacks from the patient. So I think it would be really important that you create some verbal skills. Maybe you write it down on some script cards or something like that you can talk to the patient about how their overall health affects the oral health of the patients. And so, we really want to have some good verbal skills to combat the pushback that we get from patients. So it might be something like, it's really important that our doctors have a comprehensive view of your overall health, because there are a lot of medications and medical conditions that affect your oral health, that affect the rest of your body. For example, you might notice that when you take some medications that it might cause dry mouth. Well, dry mouth is an oral health disaster. And, so when we find that patients have dry mouth, whether, your sleeping habits affect your oral health. So studies show that, the diseases and medical conditions and medications that you're taking affects your oral health. And so it's really important, so that we can take the best care possible of you and your family. It's important that we know the medical conditions and medications that you're taking, so that we can take the best care of you. And so it's just really important that we talk to patients about the systemic involvement, how medications and other medical conditions affect how it affects their teeth and gums. We had a patient that had Sjogren's syndrome in my own practice, and Sjogren's syndrome causes severe dry mouth. And every time the patient came in for treatment, every time the patient came in for their regular recare, we were having to redo her fillings, her composite fillings, every single visit. And so it's really important that patients give us that information. And so I think it's just really important. It's not that it's an office policy, it's not that, hey, we just need it because of HIPAA or we just have to get this form from you. It's not that at all. It is because this is the best way that we are going to be able to take care of you, because medications and medical conditions affect the oral cavity. And so you really want to talk to patients that we're a healthcare facility. So that's how you're going to get better patient compliance. So that's our first thing. Now, our second thing is that we really need to start using electronic forms. And I'm going to dive into that right after our break.
Hey, as one of my loyal listeners, I want to offer you an exclusive video series for the 3 must-have Dentrix systems. When you opt in, you'll receive a 3-part video lesson for your daily, weekly, and monthly systems. I know how you feel. I've been there. I've been in your shoes. I know you are stretched, and you get to the end of the day feeling like you didn't accomplish anything. It's frustrating. This is a must-have. This video series is a must-have if you need some help creating a better workflow, saving time, and reducing stress. Just go to membership.navoni.com/DWM/podcast to get into the free video lesson series. You'll also be able to download a tip sheet that will help you kind of navigate this daily, weekly, monthly workflow for your practice. This video series is completely free, and all I'm asking for is your name, practice name, and your email. I never sell your information. Nobody will ever get your information from me. All I need is your name, practice name, and your email address. So after you go through the video lessons, I would love your feedback on how it changed your life in the dental practice. Or even better, maybe I'll see you in our exclusive membership. So right now, go to membership.navoni.com/DWM/podcast and get into my free video series.
All right, so let's dive into electronic forms. And, I've been using the Dentrix electronic forms ever since they came out. I think it was Dentrix version G5, I think is when the Dentrix questionnaires came out for electronic forms. So I've been with the questionnaire process ever since it came out. I helped with the improvement of the questionnaires. And so the Dentrix questionnaires is still a really good option for you for health history updates and new patient forms. There are some new players in the market that are really, really good. And so I'd love to talk to you about that. You certainly can DM us on social media. You can also send me an email. I'll put my email address in the show notes. I can talk to you about what those other options are. But electronic forms is a critical piece of patient compliance. It's also a critical piece in making sure that you're getting up-to-date comprehensive data. Because when a patient has the opportunity to fill out a health history form from home, they can open up their medicine cabinet, they can write down their medications that they're taking right there on the form, they can punch it right into their mobile phone, they can sign the form on their mobile phone, they can upload, they could take a picture of their medication list and upload it to you. So there's so many great new ways that patients can fill out an electronic form. Now, that's the first piece of the electronic form, is that it's convenient for the patient. Studies show that 76% of patients will choose a provider that offers electronic forms that are pre-filled out for you for the convenience over a dentist that is closer to their home that doesn't offer electronic forms. So think about that. So 76% of patients will choose a provider that offers electronic forms over one that does not. So it's really important that we are giving the patients what they want. And they want to be able to fill out forms on their own time, from their own device, and they want to be able to do it before they come into the practice. Nobody wants to sit in your reception area and be handed a blank form in the reception area where you have to fill out a blank form with a pen. All you're going to get is they're going to put a line through it. They're going to cross it out and say, no changes, nothing's changed. And they're going to hand it right back to you. And then you're going to write no changes in your health history. And then we're back in this vicious cycle of not getting comprehensive information. So electronic forms are critical because it's convenient for the patient, and that's what the patient wants. Number two part of electronic forms is that it's streamlined and convenient for your team. Okay, because when you have a really good electronic form system, that information that the patient has filled out on the form will sync into your Dentrix software, and you won't have to enter in a lot of information manually into the health history module, because the health history module in Dentrix is Grand Central Station. Okay, that is where the most up-to-date information is about your patient's medical conditions, allergies, and medications. This is also where you're going to find the patient's emergency contact. So if you are already using electronic forms, I would like you to make sure that the patient's emergency contact is on your health history form and not on your new patient registration form. So that's really important as well. That way the patient can update if they've had a change in their emergency contact, maybe the patient has a new significant other, or maybe they want their parent to be their emergency contact. So the patient might change who their emergency contact is. So that's really important as well. Okay, number 3 is that we want to eliminate redundancy. Okay, many times when I am remoted into your software, whether I'm doing a remote assessment, I'm doing a practice audit, or maybe I'm doing some additional training in your practice. I'm just looking around. I'm seeing where's the most recent health history? What does the Dentrix health history module look like? And I want to see if I'm finding consistent information, because here's what happens. Here's what I see a lot in dental practices is we have some team members that are writing it in their clinical note, where we have other team members that are putting it in the Dentrix health history module. And then we have an electronic form that comes into the document center. And then some people are looking in the document center for the most up-to-date information. Well, if you have different team members that are using different parts of the software and you're updating different parts of the software, then you have mixed information and you never know where the most up-to-date recent health history information is. So here's my recommendation to you. Like I said before, the Dentrix health history module is Grand Central Station. And so when you are reviewing your patient's health history at every visit, I want you to pull up the Dentrix health history module. I want you to pull it right in front of the patient so they can look at it and they can really see what is the most up-to-date information that you have for this patient. So the patient can see the medications that you have listed for them. They can see, the medical conditions that you have listed. They can see who their emergency contact is. And if they want to make any changes, they are physically looking at that Dentrix health history module and seeing what information do you have on file for them currently. And so then that the health history module is Grand Central Station. Now the electronic form is something that is updated by the patient. The patient puts their signature on it. That is updated either every year or every 2 years. Now, if you were listening to my podcast with Dr. Mitchell Gardner and Ryan Donahue, they do recommend, their recommendation is every 2 years. I see more often than not, I'm seeing offices do it every year. So they send the patient out an electronic form. The patient reviews the information because it's pre-populated, because it's pulling from the Dentrix health history module. you're sending the patient a pre-populated form, and then the patient reviews it. They make any changes, they put their signature on it, they submit it back to the office. It comes in electronically. The office syncs in the new data, and it puts a copy of the form, the signed form, either into the document center, or if you're using Dentrix questionnaires, it'll come into the questionnaire module. So, so those are the steps, so that what we want to do is we want to get better patient compliance. That's going to happen with our just educating the patient that we are a healthcare facility. You will also get better patient compliance when you're using electronic forms. That will also help with your patient compliance. Number 2 is using those electronic forms, making sure you have a good system for that. Please reach out to me if you have questions about options. Okay, I'll put my email address in the show notes. And then number 3, reduce redundancy. And then if you have a medical emergency in your practice, you will know exactly where to go for the most recent, most up-to-date, comprehensive information for your patient's health history. So I hope these tips have helped you to create a better system and workflow in your practice for not only protecting your doctor's license, protecting your practice, but also helping you to, survive the chaos if you do have a medical emergency in your practice. So thank you for listening in. I know this one went a little bit longer than I normally go, but this is a topic that is just so important. And if you found that this podcast episode was informative and you want to give it a 5-star rating, please rate it. Give us a rating, give us a 5-star review. We would love it. That is how our podcast and our information gets out to more people. So thank you so much for spending 20 minutes with me today. I really appreciate it. And I hope you have a great rest of your day. I look forward to watching your journey of becoming a high-performing dental team.